And welcome back. I'm Mabel John. You're watching continuing coverage of the World Healthcare Congress. It's 2017, and we're so pleased to have Brian Klepper back in the studio, principal of Worksite Health Advisors. It's always great to catch up with you, Brian.
It's great to be back here with you.
And you're talking a lot at this conference about high performance health organizations.
Right.
Are there such things?
Yeah, as it turns out, I got interested a few years ago in finding organizations that did things in their niche completely differently than everybody else and were able to document consistently wildly better health outcomes at dramatically lower cost. And it turns out that there are organizations like this in a lot of high value niches. Musculoskeletal management, cardiometabolic management, cancer management, high cost claims resolution, management of imaging. And it turns out that when you look at the data, these organizations get they get higher health outcomes and or lower cost. And if you were to put them all under a single umbrella, the math says that you can get better health outcomes for a population at half the cost.
How do you find them?
People send them to me, and people call me up and apply. I get 10 calls a week from organizations that say, you know, I'm the best thing since sliced bread, and then my job is to vet them and find out whether they are in fact different.
And what's your criteria?
I have 6 questions that I ask. So I first say, explain to me what it is that you do in a paragraph or less. And it turns out that a remarkable number of people can't do that. The second question I ask is, show me longitudinal data over a period of time that demonstrates that you consistently get better outcomes at lower cost that's measurable. And show me the math. And the third question is, show me testimonials from your clients that will attest to the accuracy of that data and your ability to execute. And I'd like to be able to talk to them.
Okay.
The fourth question is, are you scalable? It's great that you're doing this in St. Louis, but I need to have this done in Utah or Providence, Rhode Island. The fifth one is, are you enduring or sticky? In other words, it's great that you can get a result after 3 months, but are you still getting a result after 3 years? And the last question is, are you confident enough in your ability to perform that you're willing to put some of your fees at financial risk against the performance targets you claim you can achieve?
Okay.
And if they're not willing to do any of those things, they're not worthwhile looking at.
Okay, so after you've vetted them and you've decided these companies have fulfilled the criteria, what happens then?
Then I take them to employers and unions, and that's when the action begins. Because as it turns out, most health plans are not interested in this at all. There's a widespread idea that health plans want healthcare to cost less, but in fact, health plans make a percentage of total spending. So they want healthcare to cost more. And as a matter of fact, the big health plans like United, Cigna, Aetna, Humana, Anthem, their stock prices pretty much across the board have gone up more than 500% in the last 7 years. And so if healthcare ends up costing less, their net revenue drops and their stock price would drop. So they're in a box. They can't really go back. They need to make healthcare cost more and more and more. So the opportunity is there for these kinds of organizations to come together and really make inroads with self-funded employers or health plans that are at risk, like Medicare Advantage or managed Medicaid. Part of what we've done at this conference is we have pulled many of these organizations together with a lot of employers and consultants to say, look at what these organizations are capable of doing. So let me give you an example to make it palpable. So there is an organization here out of Tallahassee, Florida, that has devised a better way to manage musculoskeletal problems. Musculoskeletal problems are 30% of healthcare dollar, and this organization has some big clients, and there have been 100,000 patient encounters, and the data show that they get not just better results, they get hugely better results. pain reduction, activities of daily living improvement, range of motion improvement, in half the recovery time of conventional orthopedics and at half the cost.
Okay.
So if you do this one thing, as an employer, your healthcare spend can drop somewhere between 4 and 12%. It's an enormous amount of money. Okay.
And what do you think where can they go from there? I mean, are companies open to these kinds of new?
They're increasingly open.
Companies?
Yeah,
Yes.
yeah. Employers and unions are hugely frustrated with the amount of money that they're paying on healthcare, and the relentless cost increases, and the behavior of the healthcare industry, which is predatory. So they're looking for solutions, and so if you can focus first on the early adopters and prove the concept, then other employers will see it and they'll go, I want that too.
Right. What are some other messages you're leaving with attendees this year?
I think that the big message is that a better way is possible, and that there's no reason to be rigid about doing it the old way, and that if you listen just to your broker, who's probably in league with the health plan and is part of the legacy system, then that's the wrong way. I've been working with Vidar Jurgensen, and we're about to announce in a few minutes a new set of awards that will recognize validated health value at a high level. That's very exciting. And there's this other project, which is unrelated at all, where we're talking about a methodology to create a high quality workforce, medical workforce, for the third world, for the developing countries, called Global Medical University. It's the brainchild of Dr. Devi Shetty from Narayana Health in Bangalore. Hugely exciting. So these are wonderful projects, and they all speak to a real rosy future.
Terrific. Well, I look forward to our catch up next
year.
We'll
do it next year too.
Thank you so much, Brian.
Thank you so much.
And I'm Mabel Jong. Thanks for watching.